So good afternoon, everybody, and welcome to the Women's Forum panel this afternoon, Underhyped, Overstretched, Health Innovation in Asia. My name is Lisa Salud and I'm the General Partner of R3I Ventures, a venture fund that takes deep science out of the labs of Singapore and commercializes them internationally, with the agenda to do three things. One is, of course, to improve patient care and outcomes. Two is to reduce the burden of over-hospitalization or re-hospitalization, and ideally to take fraud and improve governance in the system. I'm joined today by my esteemed panelists. On my right, Harjit Gill, CEO of Asia Pacific Medical Technology Association. She brings to the table a wonderful perspective of the industry landscape and is going to share that with us today. I'd like to say on my right here, Aleli Asila, President and General Manager of Reckitt Benckiser Health in the Philippines, who brings to the table a company lens on the dialogue today. On my left, you'll all know her very well, Rosaline Chow-Koo, our pioneer, CEO of CXA Asia, leading one of the most ambitious insurtechs in this region, looking after the health and compensation benefits of us all. And to her left, James Miles Lambert, CEO of Hello Health Group, pioneering education across the emerging markets of Asia. And to our very left, Her Excellency Dao Maya Lay Sein, Deputy Minister for Health and Sports of Myanmar, who brings today a country perspective to this dialogue. Now, as you know, Asia will soon be home to over 60% of the world's population aged 65 and over by 2030. That's over 500 million people. And medical insurers expect that the gross cost of healthcare benefits is increasing by 10% every year. And soon, healthcare will simply be unaffordable in many markets in the region. The prevalence of obesity has doubled since 1980. And while we have a range of policy levers in place and a ton of technology coming down the pipeline, it's just not so easy to get it to market. Harjit, you are our dearest friend of industry. Please tell us, what are the complexities of pioneering these technologies across the emerging Asia market?
Thank you, Lisa. So let me first start with a couple of facts. As Lisa mentioned, this is, in terms of population, a huge region. When you look at medical devices, and that's the industry that I represent, it's a region that's valued at over 100 billion. If you then take another step or a deeper look at that, it's a region where also 70% of the products we sell are actually imported. That's an interesting insight because it also says a lot about our own capabilities and capacity out here to innovate. When you look at it from a disease perspective, 55% of the deaths in this region are due to non-communicable diseases. So then I talk about heart disease, respiratory diseases, diabetes, cancer. So these are the four big killers. But more worryingly, in Asia particularly, a third of those deaths are under the age of 60. So we do have a burning platform. If you then look at the region, there are all of the major players out here. But when we look at how complex the region is, how fragmented it is, it's not an easy journey. So just to give you another couple of insights there, we have countries like Australia, Japan and Korea, which are hugely developed with a strong regulatory framework. And then we have countries in the ASEAN territories where there is a limited regulatory framework, where there are differences in levels of compliance when it comes to business practices. And also where, you know, you get governments sometimes making arbitrary calls on pricing, so quite a bit of trade protectionism. Now, in this landscape, we have to learn to operate, and we have to improve affordability and accessibility of devices.
Now, we have a world-first severe dengue technology in one of my ventures, and I have to confess that some of these emerging markets won't see it for at least 5 years, despite their nations being endemic. What are the systematic challenges that we have from a payer perspective that makes this so difficult?
So in this region, the lack of access to healthcare is key. We spend less than 5%. So for payers, a lot of the work they do is very much around people that can afford healthcare. And more, we have to improve that accessibility. We have to improve accessibility by coming up with cheaper innovations that drive access. We have to come up with new business models that drive access. And we also have to improve the entire regulatory framework around that innovative landscape. So when you talk about things like digital technologies, platforms, new ways of doing things, it does take a long time. And also for payers, it's a hugely complex area to navigate. So I think that if you have, and that's why I'm in healthcare. I'm in healthcare because I really do believe that through innovation, you can really make change, but it's not an easy journey, and it is a long journey, unfortunately. Yeah. But the benefit at the end is the lives that you save. So there's nothing for me more rewarding than that.
Now, with innovation top of the agenda for everyone across this region, what role is your organisation playing?
I'm getting all the questions, sorry guys.
That's okay. It's first, I just start with an industry perspective just to set the landscape for us all.
No problem, I'm just joking. So APAC Med, we're the voice of industry. We represent all of the major medical device companies in the region. Anything from, or anybody from J&J, Siemens, Abbott, Medtronic, Stryker, so the big players. Mm-hmm. We also represent the startups. We bring these communities together. We are the one regional voice. Now, why do we come together? We come together because we know that collectively we have a better chance to move the needle. Collectively, we have a better chance to work with governments to change regulation, to build capability, to develop advocacy, and to drive innovation. Mm-hmm. So we're really that one platform that comes together in all of these areas, and then we are the independent, autonomous body that can work with governments in every single market in this region.
And what are the metrics that you use to measure your success?
For me, it's access and affordability. The sooner I can get those solutions, and not just devices, out into the markets, that's when we're doing our job. The second thing I would add is, with so much change happening in the region, I think it's really important that we have a seat at the table. Mm-hmm. In my previous days, I used to run a business for another multinational in healthcare, and having that seat at the table was very difficult as an individual company. But as an industry body, you want to be that person they come to when they're thinking of making change.
So you've talked about the challenges of access and affordability. You've talked about new business models for emerging markets that can manage and handle this chronic disease and that drive access. And you've talked about the role that you play with big corporates, but as well supporting us as small startups, and how you work with the ecosystem in the region on all things that hamper our market access, advocacy, new reform, issues around access and affordability. But you're on the other side of that, Rosaline. Tell us, what is it like as a disruptive pioneer in the insurtech industry? How has your journey been so far? And what are you trying to achieve?
Everyone talks about shifting the paradigm from treatment to prevention. We built a new business model to actually make that real. So we're taking existing insurance money, which only pays if you get sick or something bad happens, and we're allowing each employee to decide how to redeploy that money. We've connected the whole ecosystem, from insurers to health screeners, to clinics, to hospitals, but also diabetes management, hypertension, the gyms, mental health, smoking cessation, and we're now starting with medical devices to actually shift the money and allow each person to decide. We've realigned the incentives to get people healthier because they have a fixed budget.
So there's a very famous professor in this market, Dr. Sergey Nedazin, you may know of him. And he had this famous quote that if you want to get disruption in a system, there are really only two levers to drive in a risk-driven economy in a VUCA environment. And one is to align incentives, which you've explained what you've done. What about changing the level of information risk?
Yes. We do. Since we're pushing the decision making to the employee, I mean, they know what their family needs. And sometimes it's not more medical treatment because they're really, really young. In most of Asia, they are. It is about prevention and wellness and staying healthy and managing your risk. The other thing we've done for information risk is we've removed players out of the value chain. So now that we're being white labeled by others, we're removing the third-party administrator, linking all the clinics. We're linking directly ourselves. We're removing the brokers and the agents. We've digitized what insurance companies didn't do. So we've built the end-to-end ecosystem.
So Rosaline's company is a true player in what Bill Gates termed the friction-free economy, where transactions are instant. It's borderless, we're interconnected. So if a friction-free economy platform lowers and even removes barriers to exit and entry and gets rid of those middlemen, in principle it should enable a level playing field. So who are your future customers and partners?
They're probably my current customers. So we actually are starting to work with governments. We work with corporations. But we also work with companies that have a lot of corporate customers or consumer customers. So we're starting to white label for the banks, the telcos, the healthcare companies, the HR companies. So we do it for all of them and the insurers. And then we aggregate everyone in the healthcare system as our partners.
Fantastic. So you've really got those same side, cross-side network effects. Yes. Now, we heard from speakers yesterday that as a startup, what is fundamental to our growth and sustainability, and you are supporting the health and well-being of employees all across this region, getting venture capital stability is fundamental to supporting growth. You're soon to be called a unicorn. You're a soonicorn, so they say. You've got a $250 million valuation. You're raising $50 million. What are the lessons that you've learned along the way, capital raising as a woman, that you would pass on to those in the ecosystem funding these healthcare innovations?
So I'm famous for spending all my family's money. I would not recommend that to anyone. So try to spend other people's money, but I spent all my family's money, my children's money, my husband's money, and he's no longer retired. But I would say find money that can help you grow or build out a part of your ecosystem. You want smart money. So most of my investors now actually are my ecosystem. So we have aligned incentives to grow together. They're either the ecosystem that links all the clinics and hospitals, or they own all of the future corporate clients and consumer clients, you know, or they're a piece of it. So get smart money and you'll grow faster.
So focus on the strategics more than just those that have access to capital.
Yeah, there's money everywhere. So once you grow, there is money everywhere. In the beginning, there was no money anywhere.
Yeah.
But focus on what will grow your company and give you a foundation for future growth.
Now, trending on LinkedIn right now is this fabulous quote, "Pitch like a man." Can you share with the audience your experience on that?
So when I first started pitching 6 years ago, the head of the Kauffman Foundation said to me, "Rosalind, you need to learn to pitch like a man, because you're not." So what he said was he found that women founders were better leaders, but when they pitch, they underestimate themselves. So he typically multiplies whatever they say by 10, whereas for men, he divides by 10. I've learned to pitch like a man, and I have oversubscribed funding all the time. So it's a good learning for me.
Fantastic. I'll share that with all my female founders. And tell me, 5 years on from now, you're just signing massive deals with very large financial institutions that are just going to take you global very, very fast. How are you actually going to measure your impact as a company?
A couple things that we measure. One is, have we improved employee health? Because we have to move the needle. Have we taken pre-diabetics to non-diabetics? Second thing is, have we cut costs for firms? Now that we're taking 3 layers out of the value chain, that's the fastest way. So you'll see us in the news soon where we're helping several banks cut their healthcare costs immediately by 15%. And that's immediate, especially if you take people out of the value chain who are inefficient and aren't providing value.
Incredible. So just as a quick recap, so in terms of fundraising, find money that's strategic and smart that helps you grow. Make sure you pitch like a man. Remove 3 layers of the value chain if you can, align those incentives and ensure that you capitalize on removing information risk. And if you really want to make an impact, improve employee health and cut costs. Okay, fantastic. Now over to you, Aleli, actually. Aleli, you're the corporate themselves. You're hearing how a disruptor is changing the game to improve your health, but you've already taken some pretty active measures in improving the health for your staff, not only your general staff, but also with some specific initiatives for females. I mean, what are the actions that you've taken so far and how are they having an impact?
Okay, so RB is a global company because we've seen a lot of, the trends increasing that women in our workforce, in fact, so in the Philippines, in particular, we have 50% women representation within our workforce. We've taken steps to really engage and enact this DARE program, which stands for Develop, Attract, and Retain Women Talent, which is now globally rolled out within the company. Basically focusing on 3 pillars. So one is the maternity benefits, because we know that it's the first 1,000 years of a child's life, and therefore a mother has to be able to take care of herself as well as take care of her newborn child. It's very generous. Our maternity leave is very generous over and above what is mandated by law. So that's the first. We're actually also looking at the paternity leave as well. Locally, in fact, because we realize that a father's presence in rearing the child and a partnership is needed, we are looking at expanding also our paternity leave benefits. We also have a solo parent leave or solo parent benefits, so that, in case, and we all know that there are instances wherein a woman will opt not to be married in case of, an accident. We do offer several solo parent benefits that they can avail themselves of. We also have flex work arrangements, so remote work is being done and encouraged. We also have core work hours, as well as, basically in terms of women leadership, an Accelerate program that you can enroll yourself at to make sure that you get the right skill set to be able to move up the corporate ladder.
Fantastic. I saw the look on my wonderful husband's face 2 weeks before I had my baby when they changed the paternity laws in Singapore, and I've never seen a man happier. So wonderful. So you're developing, attracting, and retaining your female workforce with maternity, paternity, solo parent leave options, and flexible work arrangements. Tell me, what is the role that an employer can play in being personalized and inclusive?
I think for a company like ours, what we do have are conversations happening within the organization. So what we do also is, as a design of our work, we work with partners, we work with healthcare practitioners to be able to get insights on what women need, in fact, what females need, as well as, because they're gatekeepers of health. We need to be able to get into that conversation and actively participate through our healthcare practitioners, entities, key opinion leaders, as well as, online. So we've seen a great movement or a great trend wherein healthcare practitioners, in fact, used to be the gospel of truth. But now they have a symbiotic relationship. I validate with my healthcare practitioner whatever information I see online and vice versa. We also do partner with a lot of other NGOs, as well as government institutions as well, where if I may cite our campaign in the Philippines, where it's a work behind Jurex, and the Philippines is a very Catholic country, male dominated as well, and very macho. So we're providing a voice for even female, that we're targeting this campaign for them to have a say on their sexual well-being as well. So it's okay to carry a condom for a female, in fact, because, and as probably, or some of you may not know, the Philippines has the highest growth rate, okay, for HIV. Yeah. So I think we've taken a passion out of that, and be able to have a purpose-led campaign around it, and targeting females as well.
Fantastic. And, we've all been keeping our children home this week because of the haze in Singapore. I know it's quite frequent that in these instances, for example, if I had a sore throat, I would go to the doctor, and the doctor here would certainly give me a lot of medication for that. You're playing an active role in education around air pollution, which is going to be one of the biggest killers by 2050 in this region. Can you tell us more about that?
Well, in fact, when we see those numbers rising, it gives us a sense of panic and urgency, because we know we have a lot of clinicals, we have a lot of information that we can coordinate, or we can communicate to our constituents, if you may, of our consumers, to be able to make them take charge also of their health care. A case in point would be strepsils, in fact. For any first aid on respiratory infection, don't take antibiotics. We have a lot of products. It's a broad range of candy, if you may, yeah. But it's an efficacious candy that you can take for any sign of pollution, for any sign of upper respiratory infection, in fact.
Okay, so you're really educating through the fact that you're providing that general over-the-counter access.
It's not just over-the-counter, but we also put it into our websites as well. We actively engage with, educating doctors themselves,
okay,
who have access to these consumers, and health workers. So still about 70%, 80% of the population of the Philippines is at the, Class D and Class E. So the access is not necessarily online, not necessarily sometimes for their health workers, but we work with the government institutions for them to be able to, those who go house to house, we also give them information and make sure that education is right at the core of what we do.
Excellent. And tell me, as a company, what are the metrics that you use to measure your impact on women?
Actually, it's still quotas for us, and we're set to deliver numbers. Women representation, number one, at every level, at every band. Yeah. We also look at number of future and potential leaders who can take these conversations within the company and shout them all the way up to the top. Yeah. And we also take or co-own like infant, maternal morbidity and mortality rates, HIV awareness. We also use that as our barometer in each of our plans moving forward.
Fantastic. Wow, what an impact. And as a leading employer in Philippines, obviously you've got all the incentives to have a loyal workforce, giving you some economic advantages. Great, and over to you, James, the king of education. Tell us about Hello Health Group.
Thank you. So Hello Health is the leading digital healthcare information platform in emerging Asia. We launched just 4 years ago. By now we span 8 markets. We operate 9 platforms in 9 languages. We just broke through 33 million monthly unique users, which makes us the largest at what we do in the region. And we really started with this vision to democratize healthcare, right? To lead the world in the creation of healthcare knowledge, to take the world's healthcare information and make it universally accessible and useful. What we see in the context of women is in their primary role as caregivers at home, they're increasingly seeking information about topics that might otherwise be culturally taboo or unspoken of, whether it be hygiene, whether it be sexual health, whether it be around pregnancy or parenting. And so we built massive libraries of content to serve them in local language. And what we feel is that if we can do that, we can empower these women to make better health choices and ultimately live happier and healthier lives.
And mobile penetration rates in Asia are some of the highest in the world. Facebook and LinkedIn have now become replacements for our news circuits. What does that mean for consumers, and how is it changing the way that women consume and share information?
Yeah, it's a really good question. We find across all of our markets that there are actually different social media platforms that play a role. So there is no one size that fits all, right? Whether it be Facebook or Zallo or Line or whatever it may be, there's just so many different platforms that we find our audience on. What we found is that with social media, our audience is increasingly demanding of personalized information. So we started out with these broad, all-encompassing health channels, right? Anything from diabetes through sexual health, through parenting. But we found that for our audience who was only interested in one specific topic, that might not cut it for them. So we started to develop specific healthcare niche communities online, whether it be just about diabetes or just about sexual health, to really go deeper on the topic. And we found that's worked really well for us. The platforms that we manage, where they're specific to a topic, are getting some 25% engagement, which is some 10 times industry standard. And we feel like that's really because we talk specific to her needs. So yeah, social media is a really big channel for us.
And obviously that opens up a wealth of opportunities. I think about governments and how we scrape information across social media networks, thinking that that is literally the scraping of our data sets. But it's not the case, right? Because quite often within these social media outlets, we have microcosms of closed, private conversations that are taking place. What opportunity does that bring for your organization to work collaboratively with governments?
Yeah, for sure. So to give you an example of that, right, so we launched the sexual health Facebook page in Vietnam, and we just weren't getting the traction that we thought we should get. And we found that it was because women in general were a little bit embarrassed to be seen to be reading that content or sharing that content. So we decided, okay, well, we'll switch our efforts towards Zallo. Zallo, when you follow these pages and you read this content, it's a bit like WeChat, right? It's private. And we found that we built a community of 700,000 people in less than a year just for sexual health, just in Vietnam, sharing tens of thousands of times a day because it's a private community. No one knows except the one person you share it to, right?
Yes.
It'd be impossible for government to get access to that data by simple scraping methodologies. And so when I think about how we can work with government, I see really two key areas. So first is data partnerships, right? And second is helping to disseminate and distribute content for government to further their own agenda. So if I think about data partnerships, if you look at the SDGs, right, 14 out of 17 of them, they don't have enough data available to understand and truly measure progress.
Yes.
Why is that? Data's not disaggregated by gender.
Yes.
So when I think about our platforms, particularly as we start to gain more scale, we're collecting massive amounts of data on what it is that women care about, what are their concerns for their family. And in a way, what we see is that could become a driving force to augment government decisions around primary healthcare, right? Where should they be placing their healthcare resources and how to focus on that. Second, when it comes to education and dissemination of content, right? Every government has a certain healthcare agenda and each has separate messages that they want to deliver, but they may not necessarily have the know-how on how to get it to the widest possible audience, right? They may not be these digital natives, you could say.
Yes.
So I would like to be partnering with government to be able to get their message out to the right audience at the right time. We've actually made quite a lot of progress with that in Myanmar. We partnered with the Ministry of Information, which was really exciting for us because they actually wrote to us instead of us constantly having to knock on doors. And we've made quite a lot of progress in Myanmar in building that community and building that education. So with my fellow panelists here, I'd love to be seeing what more we could be doing in Myanmar and the government there.
And I've been working in the Advanced Digital Science Centre of Singapore here, where they've been building the algorithms around prediction and prevention. And for example, we know that if we can test a woman's weight, if it increases by 15% overnight, then we know she's predispositioned to a fall. One of the biggest killers for the elderly is, of course, falls. You're taking this data on a daily basis through your platform. Is there an opportunity to be not just a healthcare information provider, but really to be a healthcare provider in that context, predicting and even preventing incidences?
Yeah, sure. I think for us, what we like to do is focus on what we're best at, and what we feel that is education. So what we're increasingly looking to do is build partnerships with the rest of the healthcare ecosystem.
Yes.
And you could think of it as a funnel, right? And we're at that top of the funnel, capturing women's interests and their concerns. And then naturally, they're going to look for where to go next. And for that, I feel as if we can be directing them towards the best partners, the best clinics, the best doctors, the best insurance providers, and so on, to help them make better and more informed decisions. So certainly as I look to our future, I think data and partnerships around that is a big thing for us.
And especially as our healthcare system is burdened by the huge volumes of people that it's going to have to deal with in an aging and chronic disease-ridden society. I would imagine as we move healthcare from the hospital to the home, that data will get richer and richer. What do you see the next 5 years playing out for you as?
Yeah, that's, again, a fantastic question. For us, I see the future of healthcare as democratized. If you took a look back, say 10 years, you had to be either wealthy or speak English to have good access to healthcare. Today, through the power of internet, through platforms like ours, but others also in other parts of the ecosystem, everyone has a much more level playing field. With that, what I see in the future is a more proactive stance towards healthcare, as opposed to what historically has been a little more reactive. And so as patients start to go and speak to their medical providers, they're having gone through a much more rigorous information gathering exercise. They're going with the right questions and with the right information. And ultimately that should reduce the burden on the healthcare infrastructure and essentially lead to a higher level of care that can be given to them.
And as we work towards the future of work, which was a panel earlier today, I imagine many of these questions that people are asking are the same questions over and over again. Is there not a chance for you to automate some of those? For example, I have this pain here. It's located in this area. Can you chatbot some of that, and as it gets more complex, move it to a human to have a two-way conversation as opposed to a one-way conversation? Do things like holograms, perhaps in a school or a workplace that wouldn't traditionally have a healthcare provider, provide an option for you to provide your healthcare information? Are you looking at this agenda as we move to the future of work?
Yeah, 100%. We've already started to develop numerous chatbots that are specific to certain topics. In some instances, we pioneer them together with partners. In others, that we build them ourselves. As we look at new technologies around holograms and so on, it makes us very excited to see the role that we can play with that. Again, I see it coming through partnerships, right? A lot of this technology already exists, but just not so much in a healthcare information or healthcare education context.
Correct.
And that's the bit I think that we bring to the table. So certainly the future for us is partnerships, and that should enable us to extend our influence into society.
And language and culture has always been the biggest barrier here. In the context of healthcare, adoption is fundamental, and for adoption we need trust and we need rapport in the way in which we receive and are served that level of information. What do you see as the levers for trust and rapport today in your system, and what might they be moving forward?
So for us, trust has to be earned, right? And I think you earn it through certain understanding. So when we look at our audience across each of our markets, they have very disparate needs. And so if you applied a one-size-fits-all to that, you're simply not going to get very far unless you're not going to build that trust. So we place a great deal of effort in understanding the specific needs that our audience have and the context within which they live, So people will say to me, you know, they could look at WebMD. Yeah, that's true, they could, but a US audience has a very different income to what you have in, say, Cambodia or Thailand.
Yes.
And thus it's simply not as accessible to them. So we're working increasingly to build communities such that we can gain deeper understanding of what it really is that women look for their families, with a view to promote that trust. And ultimately, one of the key measures for that is the frequency with which our audience come back to our platform. Right now, we sit at circa 40% repeat across the platform, but if you look at it for, say, pregnancy in particular, that's at 70%. That's huge. And what we see from that is that it's because we've taken the time to understand Pacific women's needs, particularly during pregnancy, such that they choose to come back to us as almost a companion for that. So if you looked at, say, prenatal and postnatal concerns, we did a study across 6 of our markets, and whilst we found that the topics were somewhat similar throughout, the weighting of importance between them was vastly different market to market, right? So in Vietnam, women care a lot about planning their pregnancy, but not so much about how they're supposed to feel during pregnancy. But in Indonesia, we found the exact opposite, right? And then postnatal, we found that Vietnamese women care a lot about digestion, but far less so about lactation. But in Indonesia, we find that women really care a lot about lactation, and they're breastfeeding for a much longer period of time. So only by being able to operate at scale can you start to get that data so as to service our audience and ultimately build that trust.
Now, we've all seen companies like 23andMe who've seen the potential of data and has commercialized that onto organizations like GSK. You're gathering intensely deep and intimate information about a woman's health and her family's health on this platform. What role are you playing in the protection of that data in the context of your futures?
Yeah, that's again, a great question. We started paying a lot more attention to our data this year. We hired a head of data, the first time we've had one, so we were sitting on all this data for such a long time, but not doing a great deal with it. So now we've been investing increasingly in our data science team, our data engineering team, our BI team, and so on. As we build out our data warehouse, what we start to see is that the power of what we're sitting on is absolutely immense. So we're working with our partners on what the appropriate commercial model for that is. Ultimately, it's about putting our audience first, right? And I think that it'd be very easy to sell the data to a large corporate and then be done with it, and you've suddenly not got a business left because you've not got an audience behind you. For us, I think it's about saying if we can leverage data to the benefit of our audience, but also create commercial benefit for our partners, then we've got a winner there. So we're working that through with our partners, and again, I think it's a very exciting future.
And capturing that informed consent on the way through.
Absolutely.
Excellent, glad to hear it. Okay, so you've talked a lot about the complexities, the cultural differences and idiosyncrasies across your markets, the regulatory and compliance differences, the language barriers, but also about the opportunities, that scope for cross-market analysis and insight gathering, both for people as well as for the governments that serve them, and as well as how you scale that across Southeast Asia, a population of 600 million plus, right, moving forward, and using data as an asset for both prevention and information. Now over to you, Dr. Maya. You've got the biggest job of all of us in this market. You look after the health and well-being of 54 million men, women and children as the Deputy Minister of Sport and Health in Myanmar. Tell me, what do you see as the biggest challenge in accommodating universal healthcare needs today? Thank you, James.
Good afternoon. Yeah, first of all, I would like to call your memory, where am I and where is my country? So I'm come from Myanmar. The Myanmar is a lot of border. Why I'm going to explain to the border? Because I have to explain what is the health problem in our country. So at the west, we have the Bangladesh, India, all the north, we have the whole border of China. And after that, Laos and I think the Southeast Asia, and we have another border is Thailand. So a lot of long way border between our country. So according to your questions, we have 51.4 million of people, and we also have 135 ethnic group in Myanmar. We all have 48.2% of male and 41.8% of female. So 27% is our reproductive age of the woman in my country. So this is my country situation. And according to your question, we are following the universal health coverage. Movement in Myanmar has been picking up momentum over the past few years. The country's political leaders has expressed a strong commitment to accelerating progress towards universal health coverage. Universal health coverage goals form an integral part of Myanmar's road to sustainable growth and poverty education in support of broader vision to enhance, uplift, health, social cohesion, sustainable human and economic development of Myanmar through a sustainable health system. The national health plans, we have a national health plans. National health plans aims to strengthen the country health system and pave the way to UHC, choosing the path that the explicitly pro-poor. The aim of goal of our national health plan is 2017 to 2021. This is the second year now. So it's to extend the access of basic essential package of health services to this entire population while increasing the financial protection. And also the guiding principle of national health policy are equity, inclusiveness, accountability, efficiency, sustainability, and quality. So the basic health package of health services emphasize the critical role of primary health care and delivery of essential services and intervention to township level and below, starting within the community. We have 333 townships in our country. Efforts to strengthen the health system are largely organized along the four pillars. So namely the human resources, financial resources, service delivery, and health financing. So our Ministry of Health and Sports focuses on different aspects of health services, implementation on various groups are categorized: age, gender, socioeconomic status. We have an ethnicity group and also religious residents in the certain zone, sexual orientation, disability, etc. Our Ministry of Health and Sports considered that some population group may have special needs. Drug user, utilizing for those groups needs to be removed. The National Health Plan strategy will enhance equity in many ways. For example, the expansion of services delivery in the township with the greatest need given as a priority. The basic health service focus on primary health care services and the intervention that the poor and vulnerable need. Vulnerable mean maternal, infant, old age, need most, and reducing out-of-pocket payments by poor and vulnerable households by increasing government expenditure on health.
Excellent. So just coming back to my three pillars in terms of improving patient outcomes and saving lives, you've got your program for reducing infant mortality with maternal health tablets and iPads out there in the community. Reducing rehospitalization and unnecessary hospitalization. You're looking at healthy living programs for your aging. And ensuring governance in the fabric of your healthcare systems. You've got a patient safety area now set up, as I understand, with Singapore Health. Can you tell us more about the last one, the partnership with Singapore Health?
Okay, we are doing a patient safety program. So we have a collaboration within our Ministry of Health and also the Singtel, the Singapore General Hospital. So patient safety is very important for us. So the save of the patient is when you started in the history. So we call the AI in the artificial intelligence. It's not the artificial intelligence. This is the history. We have to start from the history and the database. And after that, we are going to be predict and also prevent the diseases and what we are doing. And then also the prevention of for example, like the bed, when you need the bed and readmission. So we have to do that, all the data in the big database together and get to prevent the patient harmful. So that is we prevent that one too, yes.
Excellent. And the challenges in Asia are complex, and we can't do it by ourselves. That just brings us back to the end. We've heard the industry perspective about some of the complexities around regulation, licensing, and market access. We've heard the company perspective of the actions that we can proactively take in our workplace to drive equality and access for our female workforce and to support those unique needs. We've heard the words of the pioneer marching towards providing better compensation and benefits to support both prevention and treatment of our healthcare well-being and mental health in the workplace. And from James, who's talked to us about access to education. And finally, from Minister Dr. Maya, talking about the complexities of delivering basic healthcare to a population and the active role that government are playing in that. Finally, I would like to invite you all to leave one parting actionable message that we can all take back to us and our workplace. What's the key action message for accelerating health outcomes through diversity, Harjit, that you would like us to take back to our companies today?
So actually, I wanted to bring the piece of the patient in. We've spoken about population health management, we've spoken about the complexities, all of the areas that Lisa summarized, but we are all patients.
Yes.
And moving the needle in healthcare is taking responsibility for our health. And what I would say and what I would like to encourage is that knowing that non-communicable diseases that come back to the kind of lifestyles we lead is going to be the biggest killer, not only in Asia, but everywhere in the world. I would encourage us all to take ownership of our own health, manage our health so that we are avoiding exacerbations and incidents. And through doing that, not only is it better for us, but it also reduces the cost of healthcare and takes healthcare to the areas that we want it to be, you know, when we have emergencies.
Excellent, thank you. So taking ownership and responsibility from Harjit. Over to you, Lily.
Well, I'd like to pick up from what Rosalind said, and it actually just hit me. So I'd like to make a call for all the private sector companies here, particularly for us as well. It would be great, really, to see some policy changes and affect some corporate benefits and packages to move towards, because right now the model is maximum benefit. And it exposes all of our employees, not just female employees, but exposes us as part of the workforce from catastrophic experiences or illnesses, and they're not covered. So charity begins at home. I think we'll have to rethink the way we offer our corporate packages, corporate benefit and insurance packages for all our workforce.
Excellent. So rethink compensation and benefits and put it back in their hands for personalization. Excellent. And over to you, Rosaline.
So companies are already spending a huge amount of money every year on healthcare and insurance. Allow your employees to take control of that money so they can shift it to where they need help. And it's different for every single person and their family. So allow them to personalize that benefit and allow them to shift that treatment money into prevention and prediction and to get their families healthier.
Excellent. Hear, hear. Over to you, James. What's your key action message for us all?
I'm going to mirror Harjit. Knowledge is power, and in today's digital age, we each have increasing access to that healthcare knowledge to enable us to make better decisions. Ultimately, we believe that with that knowledge, we can take that and direct that course of action towards healthier and happier lives and decisions.
Yep.
And so for the audience, I urge all of you to lead and to promote amongst your friends, your families, your co-workers, your employees, a more proactive stance towards your own health management.
Excellent. So knowledge is power. Let's all become healthier, happier, and live longer. Over to you, Dr. Maya. What's your parting message for us all?
I'm working as a Ministry of Health and Sports. I'd like to give you one strong message. This is we are living in healthy lifestyles, and also we have sometimes we have a problem in our mental area. So that area you have to be copes, and then you have to practice in the mindfulness. And the last one I would like to give you is I already mentioned about our country. What are the borders between us? We have ethnic groups, and then we are looking for the peace and between our ethnic area. So the health is a bridge, for the peace. So our nation, very eager to get the peace and stability in our country to promote our people health for lifelong. Thank you.
Excellent. And so a very key message from Dr. Maya, be mindful. And I have been using my mindfulness app on a daily basis. Certainly a very good lesson. So a quick sum up of our panel today. We've heard the industry perspective, we've heard the company perspective, the pioneer's perspective, the educator's perspective, and the country's perspective on our underutilized and overstretched ecosystems in Asia. Please join us, take ownership of your health, rethink health for our employees and our workforce, allow personalization, be mindful, and remember that knowledge is power. I encourage you now to join us for a break, have a cup of coffee, cup of tea. Let's connect, engage, and trade together. Thank you very much.